Hello everybody, I am Dr. Deeksha and you are watching Urogynecology for Beginners. Since long time we have not discussed a research article in our channel which we had started doing a few months ago. So today I picked up an article for you which is very recent, published this July, this month itself in the year 2023. The article is from IUJ, which is an official journal of International Urogynecology Association. The study was done in Taiwan. Why it interested me was the reason that it talked about surgeries done for SUI, and not just a cross-sectional study but a data flow for last 20 years or so. They tried to compare in 5-year subgroups how the trend has been, which hospitals it was being done, what kind of doctors did surgery, what kind of surgery was the most frequently done surgery in these last 20 years. The data is from 1999 to 2018, which is a 20-year, a big time frame. And maybe the data in today's scenario might look a little old. However, it definitely tells the situation, how it has been over the years, and it gives a future direction to all of us to find out what has been happening in past 20 years, in the recent past, and how we are going to go ahead with this kind of information in the article. So let's start reading the article together. So as I told before, the journal is IUJ, International Urogynecology Journal, and the paper, this which I am going to read today with you, is published in the July issue of the year 2023. The title of this article reads, A Timeframe Comparison Study of Surgical Volume Shifts on Female Urinary Stress Incontinence Surgery. As all of you know, that SUI patients are initially treated with conservative management, most common being the pelvic floor muscle training, and later, if they are not responding to the treatment or are severe cases, are treated with surgery. The most common surgery throughout the world had been mid-urethral slings. Mid-urethral slings have many advantages, like they are highly efficacious, have shorter operation time, shorter recovery time, and lower failure rate compared to any other surgery which has ever been done in the past for SUI. The idea behind this particular study was to investigate the shift of surgical volume among major surgeries for SUI over a 20-year period, that is from 1999 to 2018, in various parts of Taiwan. What other things they tried to assess was whether there was a shift in surgeons' age, gender, specialty, that means urologists performing now more or gynecologists being the more performing surgeons, as well as the type of hospital, whether local, district, or university hospital, what kind of hospitals did most of SUI surgeries. It was a retrospective population-based study. The data was collated from the national database. A total of 51,000 plus women was included in the study. That means in that 20-year time, more than 51,000 women underwent some kind of surgery for stress urinary incontinence. These surgeries included needle suspension procedures, retropubic and obturator tapes, periurethral injections, pubovesical slings, Birch-Kolpo suspension, MMK procedures, and also Cayley's plication. To study the trends, they divided the entire 20-year duration into 4 groups of 5 years each. That is 1993 to 2003, the first period, 2004 to 8, second period, 9 to 13, the third one, and 14 to 18, fourth period. The variables which were included were patients' age and other characteristics where surgery was done for them, and specifically the surgeon who operated, that surgeon's age, gender, specialty, and surgical volume. Hospital characteristics, whether it was an accredited center or a private setup or a local hospital, was also noted. So when I was saying surgical specialty, they were, let me clarify it a bit more. When they said surgical specialty, it was characterized or classified as gynecology, urology, and other subspecialty. And when they said surgeon's surgical volume, very interesting, note this. According to them, if you have done 30 or more procedures, you are a high volume surgeon. If you have done 5 to 29 surgical procedures for SUI, you are called a medium surgical volume surgeon. And if it is less than 3 cases, till now, that means you are a low volume surgeon. So, what was the final observation or results of the study? I have told you that 51,018 patients underwent SUI surgeries in the 20-year study period. In that, the first 5 years, around 8,000 surgeries were done, which increased to 13,000 in the next period, 15,000 in the third period, and dropped to a few hundreds less in the fourth period. We'll discuss why this happened. If we focus on the type of surgery, it seems that the frequency of mid-urethral slings significantly increased during the first 3 periods. And the frequency of urethropexy, that is like Birch-Kolper suspension, and pubovaginal slings decreased consistently. Most of the surgeries were performed by high volume surgeons, and I hope you remember high volume surgeons means those who have performed more than 30 surgeries for SUI. Yet there was a trend which was noted that from high volume surgeons there was a shift from medium to low volume surgeon in this study duration, except for the fourth period. And actually it is very interesting why everything is changing in the fourth period. Remember this and try to think why it is happening, and we'll discuss it when it comes to discussion part. This is the pictorial representation of what I just told you. The high volume surgeons were doing maximum surgeries initially, which dropped down in the third phase, while the median surgeons, mid-level surgeons, picked it up. But in the fourth period again, however, there was a drop in the medium level surgeons, and there was an upsurge in the surgeries done by high volume surgeons. Major surgical types were mostly performed in medical centers, but this was gradually shifting from medical centers to regional and local hospitals. Now, this is something interesting. Male surgeons are still the main operators of major surgical types of SUI surgeries. However, a twofold increase in the proportion of major surgical types was seen done by female surgeons during the 4 periods in the study. The percentage of mid-urethral slings in particular performed by female surgeons increased significantly from 6.2% to around 17% by the end of this study period. However, this is not enough. We have to get into the game in a much bigger and much better way. And who do you think does the most number of SUI surgeries, gynecologist or urologist? Look at this. Gynecologist accounted for about 3/4 and urologist about 1/4 of all surgeries done for SUI. In the subgroup analysis, as mid-urethral slings was the most common surgery performed for SUI, they also tried to do all this analysis individually for only MUS surgeries, and the results were more or less similar as it was in general for SUI surgeries. After the results, let's get back quickly to the discussion part because that is interesting. So over the 20 years period, the total number of major surgical procedures for SUI increased dramatically during the first 3 periods. And the author suggests that that is because of the wide adoption of surgical procedures and increased willingness of patients to receive surgical care for SUI. Not only the absolute number of stress incontinence surgeries increased in the first 3 phases of the study, but there was a steep increase in mid-urethral sling surgeries in this period, which increased from 27.1% to 75.8% in the third phase. It indicated the booming of MUS and the paradigm shift of primary SUI surgeries from various other surgeries like Birch corpus suspension and Kelly's procedure now to MUS. The bigger question here is why there was such a decline in fourth period when it was going higher and higher in first 3 phases. The suggested possible effect, as you would also have guessed, was the FDA notifications and warnings in the year 2011, which remained a controversial subject till 2011, 2013 to 2014 also. Likewise, there are many other studies too, which have also found a significant decrease in MUS surgery, which may have the same attribution to the negative public perception regarding the tension-free vaginal tapes after the FDA warning. Interestingly, during the study period, there was a trend shift from high volume surgeons to moderate and low volume surgeons, which started doing more and more of SUI surgeries. That may owe to the generalization of these procedures as well as to the spread of knowledge and skills. Similar kind of trend has also been noted according to other authors for benign gynecological surgeries like hysterectomy. That is because of the spread of knowledge and acquisition of skills at multiple levels. If you try to concentrate on the surgical practice in our societies, you will realize that traditionally patients who were undergoing surgeries tended to cluster to some famous, usually high volume surgeons. But what has happened in recent past because of the upsurge of social media and high internet, people are more and more trying to go, or the availability is more and accessibility is more. They are trying to seek help also from the mid-level and low volume surgeons. It has become easy for the patients to find them. Same phenomenon seems to be happening when it came to surgeries for stress urinary incontinence too. But with the FDA related controversies, surgical volume once again came back in the fourth period to the high volume surgeons and bigger centers, as maybe the mid-level and the low volume surgeons and the centers were scared of the FDA warnings and had less trust in their surgeons or their techniques. But remember, there is no consensus that how do we classify a low volume surgeon from a mid volume surgeon from a high volume surgeon, because there is no surgical cutoff that tells exactly how many cases one person should have finished to say that surgeon finally a high volume surgeon. The things are still under study, but there is definitely no consensus on that as of today also. Exactly as the volume of SUI surgeries has shifted from the high volume surgeons to mid and low volume surgeons, the proportion of major surgical types of SUI surgery has shifted from medical centers now to regional and local hospital. And similar thing has been seen with mid-urethral slings. A few more interesting things were the focus of this analysis and this discussion. One of them being that the female surgeon number is increasing as far as SUI surgery is concerned. It is not only true for all SUI, but for MUS surgeries also the trend is the same, that the number of female surgeons is increasing. From first phase it was around 6.3, and in fourth phase it became 10 times more, around 16.3%. Interestingly, this phenomenon is not happening only in Taiwan. Even US studies are showing that in last several decades, female surgeons are increasing. The other explanation for this increased number can be the same gender preferences of patients due to their religious beliefs, cultural backgrounds, emotional relationship, past experiences, and shyness to tell these kind of problem in front of a male surgeon. An interesting narrative review pointed out that about quarter of patients generally prefer to be treated by female gynecologists despite fewer professional gender stereotypes in modern society. Many women even delay the care owing to the perceived lack of female surgeons in the vicinity. Another interesting point was that the ratio between the gynecologist and urologist remained stationary when it came to performance of surgery for SUI, may it be other surgeries or even MUS. Most of the surgeries, that is 3/4 of surgery, were done by gynecologists, while 1/4 was performed by urologist. In this particular article, there was no mention of urogynecologists. Maybe that was the time when the specialty was just evolving and developing. But if we do a study there, it will be very interesting to involve urogynecologist and to study what proportion is done by urologist, urogynecologist, and gynecologist, and then compare the results and decide further. In a nutshell, this was an interesting study that provides surgical trends for SUI surgeries, a shift from high volume to medium and low volume surgeons, medical centers to regional and local hospitals, and male to female surgeons. Gynecologists have been consistent in performing more SUI surgeries as compared to urologists. I feel this was a very interesting story showing us the trend shift. It will definitely make a road ahead for future research, and it will be very interesting to know what happened after the year 2018 to 2023. And not only just to show the trend, but I think these kind of studies are very useful to inculcate some encouragements in the beginners that even they can do. It's not that patients go only to the high volume surgeons and high volume centers. If you are good and if you are providing a good care, you will get the patients. And because the number of SUI in our society is so high, you know that every third woman is suffering with some kind of stress urinary incontinence. Curative management is required for many of these women, and it is a simple surgery, and I think more and more people should get trained and start doing. When you start doing the cases, then obviously you get the confidence to do it and you get the experience. Then slowly from low to medium to you become the high volume surgeons to treat these women. The need is immense, and we must take the first step now, today. Thank you.